Fred, in Maricopa County Public Health Department. He created this for the Public Health Department, and we don't market this to anyone else but Public Health. So you'll be very comfortable and familiar with the wording, and I think a lot of it, we're going to hear some sighs of, oh, I wish I had that when I was getting accredited. But, you know, we are also equipped for reaccreditation as well. So I'm going to let Fred take over here.
My turn. Yay.
Ta-da.
And just by the way, I'm from Montana. My dad was born and raised there, and my mom and dad both went to school in Bozeman. And I've lived there for many, many years. I was just up there this past October to visit my mom and my sister. So I love it up there. It's just beautiful.
Well, good. You're a bobcat.
Yeah.
However, it is 72 degrees here today.
Are you guys in Phoenix?
Yeah.
Okay.
So we won't trade you weather. Okay.
Well, this is Maryland. I was a bobcat, and then I became a wildcat.
Oh, did you?
Oh, you did?
Well, my son was a wildcat. He went to U of A and graduated with a business degree.
Yep.
All right.
And I have a lot of colleagues at Maricopa County Health Department, so we can check up on you.
Ooh, hey.
Who do you deal with over there?
Well, primarily with environmental public health, Richard Stratton and some of those folks.
Okay. Yeah, we've been working with them for about 15 years actually, and this is where the product started its development life, was at Maricopa County. So let's go ahead and get started here. And like Andrea said, you're going to be getting a drink out of the fire hose for about the next 45 minutes. If you need me to slow down, stop, you got any questions, please feel free to do that. Or if you want to just write down things and we'll take the questions at the end, either way you want to do it. So away we go. So we're going to talk today about the VMSG dashboard, and as Andrea said, it is truly a public health performance management system. It was developed, starting about 15 years ago when we were doing a lot of strategic and operational planning starting again with Maricopa County. We did a lot of consulting work with them, and in the areas of performance management, strategic planning, operational planning, leadership development, that sort of thing. And we pretty quickly found out that we ran out of tools. We were using Microsoft tools, primarily Excel spreadsheets, and built big exotic spreadsheets to do operational planning, and realized that there was a lot of limitations. You know, for instance, every plan was an entity within itself. Looking across plans for commonalities became very difficult, and then finding ways for people to keep the plans up to date without, you know, stepping on top of each other. So we actually started developing this tool, and we were fortunate to have the expertise of the folks at Maricopa County, and then many other health departments since then contributing to it. And our background was in management and also in technology, so we were able to combine the three of those together and come up with a pretty cool system. So what the VMSG dashboard is an operational planning and execution system. And just from a definition point of view, our definition of operational planning is to be able to take any plan down to what we call the activity level, being a specific thing that you're going to do in a specific time frame with a specific group of people measured in a specific way. Now, one of the issues that we run across in public health and have for years as we were doing strategic planning work and things is that most plans, especially strategic plans, get down to what we call the objective level. And the objective level is just, here's where we want to go, but it's not exactly how we're going to get there. So it makes it almost impossible to measure, other than if you should happen to stumble on getting there, then you can go in and say, we did it. But if you have a plan that walks you through the process to get there, it's much more efficient, because then you can assign those specific activities, you can measure the activities and things. And what we're going to do is we're going to go through a couple of PowerPoints, and we're going to show you a live example in the system of how that all comes together. So one of the things that we wanted to make sure we did is have the plan almost cyclical, so that as you go in, let's say, every 5 years, you're going to build a new strategic plan. And unfortunately, what most people do is they build a plan, and again, at the objective level, there's nothing actionable in there other than to monitor things. So you're going to put that plan up on a shelf, and it's going to collect dust, and in 5 years, again, you're going to go through the process. Well, by integrating the system around the PDCA, and in our terminology, plan, do, check, and adjust cycle, the Deming cycle, it allows this plan to be continually morphing itself. So the plan is continually being moved forward, which literally means you don't ever have to do another plan because the plan is always keeping up with you in real time versus waiting every 3 to 5 years to see what you're going to be doing. Again, we're going to show you a live demonstration of that. From an accreditation point of view, the system has been used by health departments all across the nation to go through the accreditation process, and now many of them are in the reaccreditation process. Been fully demonstrated each and every case for 9.1, which is, just check the box that you've got a system. Where we like to focus our efforts, though, is around things like Measure 9.1.1. And the reason that is because FAB is really pushing hard, as if you've been on any of the recent performance management webinars with FAB, they're talking a lot about making sure that you get the performance management system down to the troops. So everybody in the department should have access, at least people at every level in the department should have access to the system and be able to, a couple of things. Number one, by spreading out that load, you can help to keep your plans up to date very nicely. Secondly, the way that we do it, people can look at what they're doing. If they're updating a specific activity, they can look up the tree and see exactly how that activity contributes to the success of the organization. So it gives them a sense of pride and ownership in the organization as you're going forward. Now, we also realize that, especially in things like your CHON, your CHIP process, you're not doing it alone. There's a lot of external partners out there. In fact, we have some health departments that are very small, a couple of people, yet they have 20 or 30 external partners that they work with, and that's kind of the how the health department is structured there. So we also allow to have external partners having accounts on the system. The system is fully multi-user, so you can have everybody in at one time if you want to, which is kind of rare, but it can happen. But you also can allow limited access, what we call partner user access, to external partners. So basically what they can do is come back in and update the activities that they've been assigned in the system. We're going to show you live examples of that as well. So performance management, we've been through doing this for many, many years, and we've gone from having this huge complex definition of performance management down to what we think, based around our work in this kind of a business model, is a pretty simple definition. And number one is having good operational plans. And again, the core of the system is operational planning. So being able to take your plans all the way down to specific activities in a specific time frame, measured a specific way and executed by specific people here. So good operational plans across the board. So each plan that you have, your the 6-pack of plans that FAB requires, obviously, plus your operational plans for each division, office, and program, and that sort of thing, should all be operational. And then obviously you've got to monitor the performance, otherwise you don't know if things are going right or wrong. So we have a lot of tools at all different levels, at the macro level, so I can monitor performance of the entire department or all of WIC or all of community health. You have micro level tools, so you can monitor the performance of a very specific activity, for instance. And then you have public facing tools that allow you to, within a few clicks, actually create a public interface so that you can share information, obviously, with the public, with your board of supervisors, or board of health, with your constituents. Very simply, they don't have to login IDs or anything like that. It just shares this information very quickly. In our last time we were at the APHA show down in Atlanta recently, FAB is in booth right across from us, and we had a lot of time to talk to them. And everything they're talking about now is transparency, because they want to build the reputation and the knowledge about public health. So they want public health to share how they're doing and what they're doing with the public. So that's where this tool came about, was this public interface called VMSG Public. Then obviously, after you're monitoring the plans, if you see things starting to move, you need to make adjustments, and that's where the PDCA cycle comes in here. So we're going to walk through a live example of how we make the adjustments in the plan. So operational planning, again, the core of the system here. We developed this planning methodology over the course of many years. My business partner, Dr. Tom Keller, was a professor at Arizona State University, Wildcats, for about 25 years. And he was a management professor. In fact, he was the top-ranked management professor at ASU. And what he did is he went out and did the investigation through academia to find out, what is the best planning model, if you will, for operational planning. And he came up with a really good model that seemed to be very common across many, many different contributors. And we took that model to our public health partners, and believe it or not, it almost came out to be a one-to-one match. And then since we've been rolling out this system commercially for many years, we find that it really does hold true, that there's most people use an almost identical planning model, Some people have a little bit of different nomenclature for what we call objectives. Some people call strategies, that sort of thing. But the model itself holds true. So here's what it looks like: a big pyramid kind of. And you'll see why, because the data is going to get wider and wider and wider as you go down. At the top is your organization or your health department. Underneath that is your org chart. So how do each of the divisions, offices, and programs relate to one another and relate to the department? Underneath that, the top level of the plan itself, we call services or initiatives. Services are those things that you're doing on an ongoing basis. So for instance, in your WIC program, you're going to do nutrition consultations on an ongoing basis, something you've been doing forever and will continue to do forever. So that's an ongoing service that you're going to measure. An initiative might be, and depending on where you are in the process, is moving from issuing paper checks to issuing electronic benefits transfer. So potentially, that's a future initiative that you're going through, and I know a lot of health departments are in the process of doing that. A lot of them have already done that. So that's a service. At the top end of your strategic plan, you'll typically have 3 to 5 or 7 strategic priorities. Those are the services in the plan. So that's the what we're going to do. Underneath that, we build a project plan for each service. So how are we going to accomplish each of those services? And that's made up of, so each group will have a set of services, as you'll see. Each service a set of goals, each goal a set of objectives, and each objective a set of activities. So that's why the pyramid gets wider. You can see that we're getting lots and lots of information going down there. And the goals, objectives, and activities just define how we're going to accomplish that service. And as you get down the pyramid, you'll see it's much more specific as you go down there. So we're going to take you through an example for our little demo organization called USA Public Health. I'm going to walk you through a live example now in the system. Okay, so these tabs up at the top, these navigation tabs, are the same as that pyramid if you turned it on its left side. So the organization here at the top, the groups, services, and you can barely see goals, objectives, activities. Those tabs highlight as I select the level above it. So when I'm selecting, for instance, I'm going to go into the Groups tab, and I'm going to select our Community Health Division here. So everything now to the right of that is going to be related to Community Health. So now I'm going to go into our Services tab for Community Health, and I'm going to see that we have 4 big buckets of services that Community Health provides. For the purpose of this demonstration, we're going to walk through the Safe Kids program, and specifically, we're going to talk about the car seat program. And we're going to build out a plan, we're going to measure the plan, we're going to execute the plan, and we're going to do feedback on the plan. So you can see exactly how the system works in that case. So at this point in time, all we're doing is kind of defining, again, the what we do, and the what we do in this case is Safe Kids. So now we're going to dig down into that project plan piece of it. So I've selected Safe Kids up here. When I select goals, I'm going to see just the goals for Safe Kids, not for these other 3 services in there. So the goals for Safe Kids, first thing you'll notice is we're starting to get more and more specific as we go down. So the first thing we have is these traffic lights up here. We chose traffic lights because it's pretty intuitive for everybody to look at a traffic light and say green is okay, yellow is caution, and red is oops, we got a problem. We added the gold bar in there as well, and the gold bar means it's been successfully completed. So in this case, that particular activity has gone through the whole process and it's been successfully completed. Now we can look and see how we're doing against the total execution of the plan here. Down at the bottom, we also have on every planning element going forward, you'll see we have a set of notes. And that's just an ongoing dialogue about this specific goal in this case, or objective or activity, wherever you are. And it might be something, it's a nice communication vehicle. Here's why. Remembering you can have your whole department. So you might have 65 people, having access into the system. And if I change that green light to a yellow light, I'm probably going to put a note in there, something like, it appears based on our current spend rate that we're going to run out of funds before the end of the project. So I'm going to change that to yellow. So now somebody else can look at that and they can look and see that it went to yellow. Instead of calling Fred, they can just go look in the notes and say, oh, I see why Fred changed that. Maybe I can help go find a grant or help find some more county funds or something to beat that up. So traffic light and notes at this point in time. So now that we've selected this goal, which is to promote and provide child passenger safety education and resources to partners in the community at large, and this is where the car seat program falls, I'm going to look at the specific objectives for that goal. So I'm going to click on the objectives tab. So at the objective level, again, we're getting more detailed. The first thing we do is on the objective level, we enter them as SMART objectives. So specific, measurable, attainable, realistic, and time-based, I believe SMART stands for. At least that's the one that we use. So we're saying that by June 30th, 2018, Safe Kids USA will distribute 1,040 car seats through various programs. Just FYI, 1,040 car seats is 20 car seats a week. So what we did is we did an analysis on our community and said, you know, the car seat program is available to people who are under a specific income. So we're saying in our particular community, we believe that we could distribute 20 car seats a week. We would have a demand, you know, based on the demographic and based on the size of the community, we'd have a demand. So that's what we're putting out there is 20 car seats a week. So it's very specific by a specific date. We also at this point start assigning objective leaders. So the objective leader is typically project manager, program manager, maybe division manager. They're managing the process to make sure that it gets done, but not necessarily actually doing the process. May not be doing maybe doing the activities, but may not be doing the activities. Very simple to change. Hit the drop down here, and it's going to show me everybody in the organization. So I can pick anybody to be the leader in here. Most times it's within the division, but it could be anywhere in the organization. So now that I have this particular objective, we're going to distribute these car seats. I'm going to look how we're going to do that with the activities. And this is kind of where the rubber meets the road. This is that operationalization of the plan. So we have a set of activities up here. They're going to get us there. Down at the bottom, you'll notice we have a lot of data. So let's walk through that real quickly. Number one, we have an activity description. And in this case, it's going to be establish a funding stream because obviously car seats aren't cheap. Somebody's got to pay for them. We have a performance metric that just says, how do we know when we've successfully completed this activity? So in this case, we're going to establish a funding stream. Once we've established the funding, it's complete. We have an activity type here, and there's 3 activity types. We're going to talk about project-based activity. It's the most simplistic, but there are 2 other types, and we'll talk about those in a few minutes on a slide here. So project-based activity has a performance metric, has a beginning date and an ending date. So within this time range, we're going to accomplish this particular activity, and we're going to measure it very simply with just a % complete. The project-based activities are sometimes a little nebulous. Sometimes, you know, they're difficult to measure. So if I'm going through this process and maybe I'm acquiring funding from several different sources, I might say, well, we've got half of the funding, so I might put that as 50% complete, something along that line. Again, we have the notes down here. On the left side, we have the ability now to assign internal and external teams. So who specifically is going to do this activity? So if I click on this little pencil icon, it's going to take me to my selection screen here. You'll notice that Diane Cox is our leader and part of the team, obviously. I go down here and see Mara is part of the team. Now, this was an activity around raising money. So potentially, Mara's in our finance organization. So maybe I'm going to attach her to the activity so that she gets kind of updated on everything that's going on in this activity. So she can kind of keep her eye on it, just make sure we're doing all the right things to, you know, get the money and keep it in the right places here. I can have as many team members as I want. So I can pick everybody I want, but I can have 1 team leader. So if I select another team leader, it clears that. So in this case, we're going to leave Diane as our team leader and Mara as a team member on here. This column on the right where it says FTE, what that is initially, it's the estimated amount of time that each person is going to spend doing this particular activity. So Diane believes that it's going to take her for doing this funding activity, it's going to take her about 4 hours a week during the time period that we're looking at. So 0.1 FTE is about 4 hours a week. Mara, same thing. What she might do is after a couple of weeks of doing this, she realizes, well, it's really only taken me 2 hours a week. So she'll change that to a 0.05 so that you can have a realistic costing, if you will, of what that is, or a resource costing. So where do we use that?
Do all of these fields have to be filled in? I mean, could we leave that FTE blank?
Absolutely. The FTE is purely optional. Okay. And it may be something that, you know, that you'll go back later on and decide to enter that when you're looking for the specific information. Here's the value of it here. Number one is we roll up the FTEs at every level. So in this case, we have for this activity, it's a 0.2 FTE. That gives us a relative costing measure for this activity. If I go back to the objective level here, you'll see down here, it's a 0.6 FTE for all of those activities combined. What this allows you to do is look at that and say, is this the best use of our limited resources? So if it is, great. If it's not, you look at that and say, well, boy, we could apply those resources somewhere else and get a bigger bang for the buck. So just one of the uses. The other one you'll see on the dashboard screen is for employee utilization. But again, purely optional, up to you if you want to do it or not. So back to activities here. The other thing now we can assign is external partners. So there's an external partner database that you manage right off the main menu. If you're an administrator, I click on this, it's going to show me all the partners in my partner database. We have a limited group here. In this case, I'm going to hire an external partner to manage this program and to actually install the car seats. Public health people probably don't want to be involved in installing car seats. There's a huge liability should something go wrong and a child get hurt, in an accident because of a misinstalled car seat. So let's put that off to somebody who's licensed, bonded, and insured to be able to do that. So in this case, we've chosen Andrea's car seat installation, and Andrea is shown as our contact. What we've done now is attached her to the activity as an external person. We also then can say we want to give Andrea partner access back into the system, because what's going to happen is you'll see is Andrea's going to want to go in there every week maybe and say, I installed 20 car seats last week. I installed 22 car seats the week before that, something like that. So it's going to happen on a regular basis. So we're going to give her limited access to go back in and do that. So that's the data around the activity. The activity itself now for this particular project is, number one, establish a funding stream. The gold bar here indicates that we've done that. We're going to create a partnership with a local installer. You just saw that we've created a partnership with Andrea's car seat installation. We got to get the word out. So we're going to give away free car seats, which is pretty cool. But if people don't know we have the program, they're not going to come. So we're going to go to our PIO office and have them put together a quote marketing program or an awareness program. And we're going to focus that program on a very specific demographic of people, the people who financially qualify, being under a certain income level. We're also going to try to get the people to understand that if they come, they're going to go to Andrea's car seat installation. She's going to qualify them, and she's going to install the car seats for them. So we're going to build that piece of it out. Our PIO office is going to do that marketing. And then the bottom line kind of is that Andrea is going to install 20 car seats a week. So that's the project plan, if you will. So let's go back to our pyramid and kind of look through that. So I mentioned we're in our little demo organization, USA Public Health. As you saw, I went to the Community Health Division. And as I walked down the pyramid here, the Safe Kids USA program, as you saw, the goal is to basically provide car seats to those who can't afford them. The objective is by June 30th, 2018, we'll distribute 20 car seats a week. And then we have a set of activities to get us there. We're going to find funding, hire an installation partner, create the awareness, and install 20 car seats a week. So this is what we call an operational plan, all the way down to the very specific level that we can measure and walk through the plan, and it'll drive us right through the plan. So now let's take that plan into the PDCA cycle here. So the first thing you'll see is that we're in the plan phase right now, and you just saw the plan. It's all complete. Next thing we're going to do is go into the do phase or the execution phase, and we're going to start running the plan. So the first thing we're going to do is go to our finance partner and say, please provide the money to Andrea's car seat installation. Andrea will go out and buy the car seats and qualify the people and install them. Same time, we're going to go to our PIO office and say, let's kick off this marketing program we talked about. Let's get the word out there to this demographic of folks and drive them to Andrea. So this is going to be happening on an ongoing basis here. Let's run this program for 10 or 12 weeks. Here's what's going to happen in the background. You're going to set up what we call real-time planning notifications. Basically, it's an email system, an automated email system. And what it will do is, and in this case, probably on a weekly basis on a Monday morning, Andrea will get it because she's a partner user. She'll get an email on her desktop, and it'll say, basically, how many car seats did you install last week? She's going to click on a link in the email, takes her back into what we call quick update. Quick update is meant to do exactly that. Put in the number of car seats she installed last week, and then hit save, and she's done that. And she's going to run this for about 10 or 12 weeks, and every week she's going to get this email. She's going to update the system as to how many she did. At some point in time,
Fred?
we're going to want to say, yes.
Fred?
Yes.
Can I ask a question? So
Yes.
in order to update those numbers, does she simply need to respond to that email, or does she have to go into the system and find a place to put that number in?
I'll show you that in a second. It's both. She will click on the link, which takes her into the system. She will log into the system, and then it takes her to a very specific screen automatically. And on that screen is where she'll enter that number.
Thank
And
you.
I'll show you that. I'll show you that live screen in a minute here. But that's a great question. Thank you. So now, after we've been doing this for a while, and Andrew's been entering that information, some point in time, we're going to want to see how are we doing. We planned on doing 20 car seats a week. Let's go check and see how we're doing here. So here's how we do that. So I'm going to go back into our system here. So this particular activity of installing 20 car seats a week has been going on for 10 or 12 weeks. The system has been collecting data in the background without your intervention. And at this point, we're going to click on this little chart and see what it looks like. So this is the blue line is the data the system's been collecting. So you can see that we kind of ramped up slowly and then we're humming along, looks like about 21 or 22 car seats a week. Kind of exactly what we had planned. Everything is good. This green line that you see is obviously the target number that we set, the 20. The red line down here is the kind of the bad value. It says, you know, we're not doing what we thought we would be doing. If it's below there, we want to know about it. So what's going to happen here is anything that's below the red line or at the red line or below is going to set that little traffic light automatically to red. If it's in between red and green, it's going to set it to yellow. And if it's above green, it's automatically going to set it to green. So any point in time, you can look and see how we were doing on that specific date or for that specific week. So at this point in time, I look at this and I say, you know, it took us a little while to ramp up, but everything is running along exactly as we expected. There's really no adjustment to be made. So when I go back to my PDCA cycle, I'm going to next go into the adjust phase. And in the adjust phase, in this particular case, there's really no adjustment. So I'm going to continue through the cycle, and maybe once a quarter, I'll go through the check process again, look at it again. Oops, okay, we're going to continue on doing the plan here. Now, let me go back here and play devil's advocate. And what if the chart looks like this? So we started out about the same. We ramped up, but it looked like we capped out about 14 or 15. What's going on? Let's go back and look and see what's going on. We're going to go back to our plan. We're going to walk through the plan. Number one is funding. We got a big gold bar there. That's good. Partnership with a local installer. That's good. We've got that done. We'll get down here to our marketing program with our PIO office. Big red light. Looks like that's our problem. First thing we're going to do is go down to the notes field here. And in the notes field, we're going to say, may not be reaching the proper demographic, only have a demand for 15 car seats a week. Okay. So our problem is in our marketing here. Everything else seems to be working fine. So at this point in time, we're probably going to take a little walk over to our PIO and say, you know, we talked about doing this marketing program. We're trying to get to 20 car seats a week. We believe that's the demand in our marketplace. What do you think's going on that we're only getting to 15 and not 20? The one answer might be, well, here's what we're doing. You know, we assigned this to John. He's our marketing expert here. And John has gone out and done a social media campaign. He's done TV, radio, newspaper ads. Here's the demographic we're targeting by, you know, kind of these neighborhoods maybe. And we believe that we're getting the word out properly. We believe we're getting to everybody. I think we may have just overestimated the demand. We really truly believe the demand is somewhere around 14 or 15 and not 20 right now. So if that's the case, we're going to go back in here. We're going to make an adjustment, and the adjustment's going to be to the plan. So we're going to take the plan from 20 down to 15 and then continue on through the cycle and see if we continue to measure at 15. If, in fact, it goes up later on, we go look and find out why it went up, and then we're going to make an adjustment to that plan again, potentially. The other answer that they might get when you went to the PIO office, let's say you talk to them and they say, yep, you know, we had this program ready to go. We assigned John to doing it. John was starting to kick along, and then all of a sudden, John had a problem. He had to go out on emergency medical leave. And John's been out for about a month, so we knew he was going to be out for a while. So what we did is we went looking for another resource to do this program. Well, we just found Bill, and Bill's got a pretty good marketing background, so he's taken over the program, but he's only been doing it for a couple of days. So we have not been actually doing the marketing out there yet. So that's the reason. We still believe you're going to get to 20, but at this point in time, we made an adjustment to the resources, the resource being substituting Bill in there for John. And then now John is going to ramp up the marketing. So we're going to go through the cycle again, give John Bill a little time to catch up and get moving. So in any case, you're going to make an adjustment either to the plan, you're going to make adjustment to the resources, or potentially adjustment to both of them in here. And then you're going to go through the cycle again. So that's how the PDCA cycle integrates in here. Performance monitoring, as you saw on the performance management screen here, lots of different tools in here, but let's talk about the main dashboard itself here. So I'm going to take you back live to the system. I'm going to go to my groups tab again and select the department, so the highest level in the organization here. I'm going to go up to this little traffic light, click on it. It'll take me to my dashboard screen. on the dashboard screen, there's three primary areas. So let's break it down. First of all, the dashboard screen is dynamic. And by that, I mean, depending on who you are when you log in as to what data you'll see on the screen. So if I'm the health officer, health commissioner, administrative officer, and I have responsibility for the whole department, what I'm going to see is the whole department on the screen. If I'm the WIC director, I'm going to see just WIC and potentially any nutrition programs that fall under WIC. If I'm the PEP director, I'm going to see just emergency preparedness on there. And maybe, again, if EMS falls under emergency preparedness, I might see that on there. But it's going to be related to who I am when I log in. Now, given that, anybody can be given permissions to see anything in the system that you want them to see, or you can limit their permissions to what they can see. But based on their login, they're going to immediately go to their area of responsibility, because that's probably what they're going to want to see. So what we're seeing up here is we've done this goals, objectives, and activities buttons is telling me what level in the pyramid I want to look at. So right now I'm looking at activities. I'm looking on the traffic light and on this gold bar saying I have 15 completed, 10 green, 5 yellow, 1 red. The nice thing about this screen is that everything on there is clickable. So I can drill down and get to the base information without having to go anywhere. So in this case, the one that's red, all of a sudden showed up. I'm going to find out what's going on. So I'll click on that. It's going to take me to that specific activity. In this case, the PIO office activity we just talked about. Again, I go down to the notes field, look at that, and then kind of do the same thing we just talked about here. But everything is clickable, so I can drill right down to it and get the immediate information from that screen. The other thing you see on the screen is the schedule gauge. The schedule gauge is telling me on aggregate, based on the area of responsibility we're looking at, in this case, the entire department, we're about 26 days behind schedule on all of our plans. And that's calculated based on that beginning date, ending date, percent complete. It's always going to be looking at that. So if everything is on schedule, it's going to be 0 or above. It'll be green. 0 to 60 days behind schedule will be yellow, and over 60 days, it'll be red behind schedule. So that's the big picture. Just by looking at that, I get a really good overview of how the department's doing or WIC is doing or whatever I happen to be looking at. Now at the bottom, I can break that down a little bit now. So first of all, I want to break it down to see how each of my people is doing who's been assigned to activities. So I have the activity leader, I have Diane Cox. This column last updated is telling me when the last time they were in the system updating their information. Green is less than 30 days, yellow is 30 to 60, and red is over 60, and that's the common across all of these here. So what we're looking at is we have some data that's a little bit dated, maybe not too bad, but we kind of like to have most of those green whenever possible, so we know that the data is fairly real time. Here's the other roll-up of those FTEs should you decide you wanted to use them. And that's basically for every activity, if you're signing an FTE, you can roll it up to that person and say, Diane is running at a 1.25 FTE or, 1.25 people. Not abnormal for public health, but kind of tough on people over a long period of time. If you want to keep good employees, you don't want to burn them out. So maybe what I'll do is if I clicked on Diane's name here, it'll show me all of the activities she's been assigned. I can look at those and say, I can take these 3. They're within Fred's skill set. I'll assign them to Fred, let him take over, bring Diane down to a 0.95, bring Fred up to a 0.95, and away we go. Lagging in days is the number of activities lagging behind schedule by person, obviously, and how far they are by color code. And then the days is the same as that schedule gauge, but it's by the individual person. So how far is each individual ahead of or behind schedule? Overdue is just that. It's the ending date is come and gone, and we're not yet 100% complete. And then we have the red, yellow, green, and gold for each person. So that's view number one. Is I want to look at my people and see how everybody's, kind of contributing to their plan. The next thing I can do is look at my org chart and see how everybody in the organization is doing with the same data here. So in this case, I look down at my different divisions. So here's my community health division. It's been a while since they've been and updated their information. The number lagging days and overdue and everything else. So now I'm looking at the organization. So I can see if I have, one division is maybe lagging behind the others, so I can go talk to the division director and get that going. The third view is strategic priorities. So these are those top level services out of your strategic plan. So for our little organization, we have 5 services, partnerships, data quality, health disparities, regulatory compliance, and branding and marketing. Same information, last updated, lagging, overdue, and then red, yellow, green. So this gives me the ability to very simply break down that traffic light so I can kind of pinpoint if there's any issues. Top right corner is called My Priorities. What that is individually selectable objectives based on your login. So everybody's screen is going to be different because these are things that I pick that I want to see when I log in. So most of those things are reds and yellows. So the things that I do want to keep an eye on here. Green means that it's going ahead fine. I don't necessarily have to watch it. Typically the things that either I'm working on or my team is working on. So I look up here and I see this green, which probably means that somebody has made a correction and that turned to green. So this data is all real time. So somebody looked at that and said, oh, it's green up here. Let's see what's going on here. Oh yeah, I don't need a baseline complete. I don't need to watch that anymore. So I just click on this little green flag, turns to gray, and when I go back, it's gone. So it's that easy just to pick and unchoose something that you want to keep an eye on up there. So now it's gone up there. So that's the main dashboard screen. Most people set this as their home screen by clicking on this little Start Here button. You can have one of several screens that's your main screen as you go in. But a lot of people like to look at that because it gives them just by color coding almost, you can get a really good idea of how your area of responsibility is performing. I mentioned the 3 types of activities. We talked about project-based activity, pretty simple, 100%, 0 to 100% complete kind of thing. If I have a number to measure here, quantitative measurement works. And here's why. If I had a WIC clinic, again, who's doing, let's say 50 nutrition consultations a year, what I want to be able to do with that WIC clinic is instead of putting in a % complete, I'm going to put in a number. So what's going to happen is this WIC clinic manager will probably get an email from the system once a month, let's say the first couple of days of the month. And it's going to basically say, how many nutrition consultations did your clinic do last month? Click on the link, go to quick update, enter that number, save it. And they're going to put in, let's say 5. Up to date, they've collected 20, 25, 20 plus 5 divided by 50 says we're 50% done. We're about halfway through the fiscal year. We're pretty much right on track. And it's going to calculate that leading, lagging, overdue, all that information based on a real number at this point. QA activities are a little unique in that instead of a manually entered beginning and ending date, it's an automatically calculated date based on the frequency of the activity. So in the case of installing car seats, it's a weekly activity. So what's going to happen is every time Andrea goes in and updates the number of car seats that she installed, it's going to increment that beginning and ending date by a week here. High and low values is that green and red line you saw on there, and that's what's going to trigger the red, yellow, green light, as well as showing on the graph where the targets are. And then metric type would just be car seats installed. So 3 types of activities. Been out there for years. Nobody's come up with a 4th yet, but we're wide open. Document management. As you guys know, going through the accreditation process, it's very, very document intensive. I don't know how many documents you guys end up submitting, but we were just working with a health department in Indiana, and they had gone through the initial process, site visits, the whole 9 yards, and then you ended up getting an action plan out of it for a couple of documents. But they had submitted 820-something documents. That's a lot. I think that's the highest I've ever heard. But one of the problems is, and I don't know how you guys manage your documents, but here's what most people tell me. They have a shared drive out there. They have a folder called Fab Accreditation. Underneath that, they have 12 domains. Under the 12 domains, they have the standards. Under the standards, they have the measures. And then that's where they put all the documents. That can work, but here's the downsides to doing that. Let me go back to my services tab. So pretty much every screen has got this little blue folder, which is my document management folder. Just by rolling over, I can see what documents are attached, and I can see how many are attached. When I click on it, it takes me to document management. By default, it only shows the latest version. So the system does automatic version control. When I put up a document with the same file name, it's now going to increment the version by 1. If I want to see all the versions, I just click up here. It shows me all 3 versions of that document here. So in this case, when I'm looking at the document, if you have a file system, you got the file name and you got the latest date that the document was saved, basically. And that's kind of the information that you have, and, size, and that sort of thing. However, that's not necessarily going to be really helpful if you're looking to find documents that meet specific, standards and measures and things. So you have the ability here to put in a lot of metadata around the document. So you've got the description, which can be as long as you want it to be. You've got notes, which are just kind of, again, they're just notes about that particular document. Who did the last update, why they did it, what's left to be done, whatever you want to mark in there. You have the FAB expiration date here. And by the way, document management system isn't specific to accreditation, but it can be used for anything to manage documents. However, for the accreditation process, it really is nice to have the things that, EFAB requires, like the expiration date, within the last 14 months, within the last 5 years, whatever that is. You also have a traffic light here. Traffic lights typically are used for a brand new document is red, a draft document is yellow, a final document is green, and submitted up in the EFAB or wherever you're sending it is gold. So it allows you to very quickly be able to go in and say, let me show you the main document management screen just because it's got more documents on it. If green is the ones that are ready to go, I can just go up here and say, I just want to see all the green so I know which ones I got to upload. So I've got all these documents here. I click here, it's going to download it to my desktop or some folder that I designate in here. Then I can turn that document around and shove it up into EFAB. Very simple process to do, and then I mark it as gold. And now
Tell us how you really feel.
Okay, what did I do?
We like that you said you wanted to shove those documents up to EFAB.
We agreed with you.
Okay. I gently placed it in there is what I meant,
Yeah.
Okay. So document management is really a nice tool, and you can attach a document anywhere. You can attach it to a person, to an organization, to a group, to a service, to a goal, objective, activity. Any place you want to attach a document, you can, and I'll show you where that really comes in handy in the accreditation project plan here. Okay, so document management, three-dimensional planning. This is a very unique feature that we developed long ago. Remember, I think I told you we initially started out with Excel spreadsheets, and we had a work plan for the strategic plan. We had a work plan for CHA. We had a work plan for community health. So we had all these individual documents. And then Dr. Bob England, who's the chief health officer here, came in and said, this is cool. Now I want to look across and see how many people are doing something for public health essential number 1. Oh, really? So we start breaking out all these hundreds of spreadsheets and looking through them and trying to figure that out. So what we did is we developed a system. We said, we're going to fix that. So if you think about having all the different plans in there, all your FAB plans plus your operational plans for all your different divisions, office, and programs, what I have is the ability to categorize those. So for instance, I can categorize all the pieces of all the plans that are related to public health essential number 1 or the FAB standards. So I can go in and say, these pieces of these plans are related to standard 6.1. The strategic priorities, as you saw on the dashboard, this is where they come from. So I tag every piece of every plan that's related to partnering. So now I can kind of summarize those. And then same thing with the documents. I can tag all the documents. So no matter where they are in the system, I can go in and say, show me all the documents for standard 4.2. Here's your list of documents. And then obviously you can turn around and move them gently into EFAB. So three-dimensional planning is really a cool tool because there's so many things that you can look at. You can find where you have commonalities, or even, for instance, every health department is kind of tasked with meeting the 12 essentials of public health and accreditation. You can go through and look and say, wow, we're doing 1, 2, 3, 4, 5 really well. Oops, we're not doing much on 6. Maybe we want to beef up our opportunity to pursue number 6 a little bit more. So it's a cool tool. Categorization.
Fred,
Sorry?
you have to enter that 6.1 each time, right?
No, I'll show you how you do it here. So if I want to categorize this particular service, I click on this little guy down here, the little up arrow, and here's all your standard public health categories on the left over here. By the way, these are completely editable by you. You can delete them, add more to them, whatever you want to do with them. But we have kind of the standard ones, like your strategic priorities from your strategic plan. All you got to do is say, okay, I want to tag it to these 2 strategic priorities. Boom, you're there. Here's the essentials of public health and accreditation. This one is just tagged to number 6. I could tag it to any one or all of them. And then down here at the bottom are the FAB domains and standards. So in this case, we have not only the current 1.5 standards in here, we also have the 31 reaccreditation measures that are actually a year ago now, believe it or not, that they came out with. So you can tag them to those. So now when you're going through what I'm sure very soon going through is a reaccreditation process, you can go in and see how you're doing against the reaccreditation process by saying, showing me everything in the system, every document, every planning element that is related to reaccreditation measure 1.1. So that's how you do it. It's just very simple. Click, 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 and you've tagged it. If I want to tag an entire pyramid, if you will, so everything from the service on down, I can say tag the service, and it'll give you an option to tag everything below it as well. So you've had that option to do it. But it's real simple to do. And then you go back through what we call a category tag report that just says, show me everything for standard 9.1. And here's every piece of every plan and every document that is related to that. So that's 3D planning. Real time, this is the one you were asking about earlier. The real-time planning system, first I'm going to show you how easy it is to set it up, because people don't believe me, but it really is. It takes you about 2 minutes if you're going really slow. Settings, notifications, and here it is. So I'm going to say, do I want to send them out? Yes or no? Okay, yes we do. When do you want them to go out? The most popular setting is the first week of the month on Wednesday. I've been told it's because, you know, the end of the month, we're going to recoup for a couple days, then I'm ready to get to work on this month. So end of the week on Wednesday, or the first of the month on Wednesday. We set it right now for every week on Wednesday. I can pick as many of these days as I want. So literally I could have it go out every day if I wanted to, but you're going to get a lot of annoyed people if you do that. It's 3 criteria for sending out the email. Number 1, have you been in the system in 30 days? If not, you're getting an email. Do you have anything lagging behind schedule? So your beginning date, ending date, and percent complete calculation. Do you have anything overdue? Ending date come and gone, you're not done with it. If any of those is true, you're going to get an email. If you've been diligent in maintaining your information in the system, you'll never get an email. It doesn't spam anybody. So that's how you set it up, and that's exactly how long it took to set it up. If I wasn't explaining it, I would have been done a half hour ago. So here's what's going to happen. At Wednesday morning at 2 a.m., the system's going to come alive, and it's going to go look at every one of your users who's been assigned as an activity or an objective leader. And it's going to look at those criteria, and if they need to be tweaked, it's going to send them an email, both internal folks and external folks. So your WIC clinic director on the inside and maybe Andrea on the outside is going to get that email. They'll click on a link in the email, which takes them back into what we call the quick update screen. I'll show you that in a minute. The quick update screen is specifically for that purpose. Originally, when we rolled the system out several years ago, we didn't have that screen. So people had to go back and find their way through, like you were talking about, figure out where to enter the information. So it wasn't taking them exactly where they needed to be. And it was taking them upwards of 30 minutes to do that. This system was designed through a lot of focus groups and stuff we had with our clients. The simplest way to do it, how little data can we enter and get this accomplished here? Literally, because like I mentioned, people set it up for once a month as the norm. So what you're asking people to do to update their information is give you 3 to 5 minutes a month. That's all you're asking for. And that's all the time it takes. And I'll show you how. So they're going to go in, they're going to update a few activities, however many they've been assigned, and hit the save button, boom, updates the database, they're done. 3 to 5 minutes a month. So here's what happens. They're going to get an email from the system if they met one of these 3 criteria. They have, in this case, it's lagging or overdue because I was in 4 days ago, it says. Just an overview of everything you've been assigned. Here's the status. You're going to assign internal system administrators. You do that from the user screen. You say, I want Fred to be the administrator for community health. And so he's going to show up on here. If I have any questions about why I got this email, I can contact one of these people. And here's the link. You click on that. It's going to take you first to your login page, like every other website in the world, user ID and password. And then when you clear that, it's going to take you to this option screen. If you've been assigned as an activity leader, which is the only way you get the email, you get a choice to go to the main dashboard or go to the quick update screen. When I go to the quick update screen, it's going to take me to here. I'll take you to the live screen, which I get through from the main menu up here. Quick update. And it looks like this. The top of the screen is merely context. So it's that pyramid, the group service goal objective activity. This number right here, 1 of 10, is telling me that I'm going to be updating up to 10 activities today. Down here is the data that you can enter. So I can enter that percent complete. If it was a number that I had to enter in here, like whatever this, I don't know what this is, correctional help meetings or something like that. So I could just enter that number, number of car seats, number of nutrition consultations right in there. A QA activity will automatically set the traffic light for you, so you don't need to do that. If you wanted to put a note in here, let's say for the car seat thing, it's the week between Christmas and New Year's, and we had no demand. We only had a few car seats installed. So just put a note in there so people looking at it. Hit this little button down here. It takes you to the next one. So here we're on 3 of 10. A lot of times when people go through this, they look at it and say, nope, nothing's changed, click the button. And literally, again, this takes you 3 to 5 minutes to go through this process, however often you set the emails to go up. So that's a quick update system. So no searching through spreadsheets, no searching through OneNote, no searching anywhere. It takes you right to where you need to be, depending on who you are when you log in. Reporting. Everybody wants to get reports at some point in time, so we have a boatload of reports. I'm not going to go through each one, but there's a report for everything that you've seen in the system plus more. And the reports mostly look like this. It's an operational plan. So this is the plan. We start out for Safe Kids. We got the Community Health Division, as you saw, the Safe Kids program, the goals, the objectives, the activities, status, note, the blue is the notes in here, how many car seats we entered, everything you want to know but we're afraid to ask. Each of these reports can be condensed down by the amount of data you want to see. If I just want to see goals, I can see that. The date range that you want the report to fall in, all of that information. So all available. Most of the reports look like this, like I say, and there's a report on everything in there that you want to have. The VMSG Public, this is a cool tool. This was brought out about a month ago after we had that conversation with FAB, and they were really pushing this transparency thing. So what we did is we created a way to take any indicator that you have in the system. That can be at any level. So it can be a group. So and let me show you a live example here. So this is the public page, the web page for our Safe Kids program here. So the first thing is, you remember, it fell under Community Health Division here. So the status of Community Health Division, this would be all of the activities for community health in this case. So it's showing me on my rollover, I have 3 green, I have 2 gold, 1 red, and 1 yellow in here. So this is, if you will, the traffic light in a pie shape. Then I have this schedule gauge that shows we're about 22 days behind schedule on what we're doing here. So that would be the Community Health Division, the group level. Down here is the Safe Kids program itself. So how are we doing overall on the Safe Kids program? Same information. And then this last one is a detailed chart, and that is that same chart you saw with the number of car seats installed, where it got up to, if I roll over it, it'll show me I have 23 car seats, I have 21 car seats, 22 car seats. So all that information is in there. Here's what you do. You go to the group, you click on the VMSG Public button. It'll just say, what do you want to summarize it? The activity, objective, or goal level. You pick that, you put the button. It creates what we call an indicator row, which is this top row. You can have as many rows on a page as you want, which can be at the group level, service, goal, objective, or activity level, all the way down. I can have as many pages as I want. So I could have 10 of these on a page and have 20 pages if I want. What you end up with is this web link. It's a dynamically generated URL, and you take that, you copy it, you send it out in an email. Here's what many people are using it for, which we never even thought about when we rolled it out, is they're using it to communicate to their boards of health. So what they're doing is creating that URL, putting it in an email, sending it to the Board of Health members so they can click on it, they can look at it, see exactly how you're doing on each of your programs. So you might have one for each division in there, or you might have one that has, the Safe Kids program and each of the different services under that, or whatever it happens to be. But again, literally easy to create, takes you a couple of minutes because it's just clicking a couple things, using all the data in the system. All of these labels and stuff over here, you can edit to make them whatever you want to show on there. So very simple process, but very, very powerful to be able to, again, be transparent. Quick Start program. We've been doing this since day one, but we just kind of formalized it so people understand that our goal is to get you up and running on this thing quickly and not just say, here you go, here's some software, go play with it. We want to get you working so that you're literally within a week. If you can provide us with the information, we will have you up and running and alive and functional within a week. And here's what happens. You decide you're going to go with us. So we put, in your case, maybe 65 users on the system. We're going to create a personalized dashboard. First of all, we're going to take your org chart, put it in there. Secondly, all of your users, obviously. And then we're going to take your logo and your header graphics and that sort of thing, put them in there. So now you've got a personalized org chart. At this point in time, we're going to send you the information for the training, and there's an online video training for every piece of the system in there. We're going to ask you to go through that, and it's about anywhere between an hour and a half and 2.5 hours of training, and it's broken down into 3 to 4 minute modules, so you can spread it out as much as you want to. But we're going to ask you to go through that video-based training, which will show you how to enter everything, how to use all the buttons, building an operational plan, the whole 9 yards. Really good training. Next thing we're going to do is ask you to send us one of your primary plans. Well, obviously you guys have been through the process, so you've got them all. So if you want us to enter your strategic plan, which a lot of times is the best place to do it, because with a strategic plan, you can involve everybody in the organization when you get down to the activity level. And that's one of the nice things, is to be able to get everybody involved so they can see how they contribute to the organization, and you're spreading out the load of keeping all the plans up to date very nicely. So we're going to enter one of your plans for you. If it's not operational already, we're going to work with you to develop the specific activities to operationalize the plan. We're going to set up those 3D planning categories. So if you have other things that you want to measure against for the categories, we'll help you to set that up. We're going to work with you to assign the people who are going to be responsible for each of the objectives and activities. We're going to set up the real-time notifications, which you saw we already did. And then what we're going to do is go through a live training using the GoToMeeting. And we're going to walk you through the plan that we put in for you and how we did the updates to if we have to operationalize it, doing the activities and things. I'm going to walk you through the whole process. Literally, after you get to this point, that training, I did it this morning for one of our Wisconsin clients, and it took about a half an hour to go through it. And they had questions about the stuff they went through when they were entering plans and the stuff we did when we entered their plan, and half an hour, and they were up and running and excited to get off and doing more of it. So that's the Quick Start program. No cost to you to do that. Last screen we're going to talk about is help and information. What we did as we were developing the system, we realized that there's going to be lots of different types of users in there. There's going to be people who are just in there on a once a month basis. What's going on here? Hello. There you are. Okay. People who are on there, daily, who are typically the accreditation coordinators and whoever are administrators. There's going to be people who are in there, once every 3 months, who are the people who are actually developing the plans. Any piece of software that you use very infrequently, you're not going to remember all the details. So if I'm on the services page right here, and I want to remember how to go about adding a service or do anything to a service, I click on the little blue eye up here. It takes me to my help and information screen. It automatically highlights the adding and managing services. First thing it does is give me this nice bullet list of everything I can do on that page. Secondly, if I click on this, it pops open a PDF user guide that's hyperlinked, so I can click on a table of contents and take me right to the area I want. Third, every piece of the system has, on average, a 3 to 4 minute video training module associated with it. Sometimes this doesn't play real good over GoToMeeting, but I'll give you the idea here. So I click on that. It's on YouTube. This module will discuss more of the planning elements in the dashboard system from other groups within a selected organization. When a service is copied, all of the related goals, objectives, and activities will be copied. So what it is somebody actually walking you through the specific process that you're trying to do. And it's on average 3 to 4 minutes. That one I think was 7.5 minutes because it's got several planning elements in it. But it's very simple to follow. What people will do is they'll go and they'll watch that. They'll toggle back over to the system. They'll go do what it was telling them to do, go back and forth a couple times, and then they're back on it and ready to go here. All of those 3 to 4 minute modules are rolled up to 4 different training curriculums. So most people would go through the user level training. By the way, in our experience, about 80% of the people in your department will never see anything but those quick update screens. The people who will see the rest of it are people who want to do reports, maybe people who want to share the information via the VMSG public, and the people who are actually doing the plans. So in that case, you're going to see those folks. So the training for the people who are just doing the quick updates is a really short module here called Occasional User Training. And basically it shows them how to log in, how to change their password, and how to respond to the quick update screens. That's all they really need to know. The administrators need to take a little bit more training, but the total is just a couple hours worth of these modules. And you can take it as often as you want, as many times as you want. Benefits quickly, cost effective for any size department. So I'll show you that in a second here. The ability to precisely manage any piece of the organization. You notice an operational plan for each of your divisions. You can go down and look at that division and see how everybody's doing, how the org chart is handling it and everything else. Identifying gaps, overlaps, and commonalities across all of your plans through the three-dimensional planning. The accreditation process. I keep forgetting this. This is something that's new that we're just rolling out, so I want to show you real quickly. I know you guys have been through the accreditation process, but recently we've been talking to FAB, and we want to roll out a complete accreditation project plan built right into the system. So what we did is we went through and talked to FAB, and they pointed us to the right information, and we start building out this plan. And here's kind of what it looks like. So it's called FAB accreditation, and this will be, by the way, 3 plans. There'll be a state, a tribal, and a local plan, because they're, you know, the 3 different elements here. Right now, this includes all of them. But for instance, so you got the 7 steps of health department accreditation. I go down here and, you know, it's pre-application, application, document selection. So you guys are probably in the reports phase here and then going into reaccreditation. All of that, there's a plan underneath all of that that walks you through everything you have to do. You have the ability to go in and assign leaders at the objective and activity level. You can assign the dates that these things are due, put all that in there, and then it all comes in through that real-time planning interface where everybody will get their notifications. They'll know what they need to do next. The other thing that we put in here is obviously all of the domains. So I go to, you know, domain 1, I go to the goals, and that's the standards. Go to the objectives, it's the mock measures. And then underneath each measure are the specifics, primarily the documentation that you need to be able to do here. At this point, you could attach, click here, you can attach the document. So in this case, you must document the process for development of your CHA. So down here, I would just attach the CHA at that point in time. Then I would categorize that CHA against whatever the domain 1.1.1 here. And so I'd categorize it right into there. And when I need to go back and find that, I'm ready to go. So that's we're in the process of rolling that out right now. We're building a tool that allows us to mass populate all of the dates and all the people in there for you, so that when we roll this out, your plan is all ready to rock and roll.
And then is that somehow tied to submission?
Oh, the EFAB?
Yeah.
No, it's really not. It's really not. It's just, and here's the reason. We've been talking to FAB for a long time. They have an issue that they can't be supportive of any one vendor. They have to be neutral. So what we've tried to do is get a link into EFAB to where we can automatically take all of those green light documents and put them up into EFAB, you know, with all the proper information. But they've been really slow, dragging their feet. We haven't been able to get through that hurdle yet at this point in time. But what it'll do is give you the whole plan that you need to go through to be able to get ready for your reaccreditation submission.
Yeah, I want to be able to have you, whoever's using the system, be able to directly upload it to EFAB. That's the goal. And we're working on it.
What do you do with it?
I have a question about the
download it and upload it.
The reports, the quick updates. You showed a couple of different, kind of a pie graph and then sort of a temperature indicator. Are those the only 2 graphics that are available? Are there other kinds of graphs like bar graphs or?
Well, currently there's the 3 available. There's the summary is this chart here. So it's the pie chart with the timeline, and then the detail is the line graph. And those are the 2 that are currently available. Again, these have just been rolled out about a month ago. We're continuing to work on them, and we're willing to take feedback if you want a different type of an indicator on there. It's pretty easy to build with the graphics engine behind here.
I have a related question.
Yes.
If you're looking at maybe your performance 1 year compared to previous years, is there any way you can show a graphic that shows that trend?
Yeah,
or just
absolutely.
For the specific time period?
Well, you pick the time period. You can say, I just want to look at this year, or I want to look at the last 5 years, whatever it is, and you'll see the performance there. Especially if you're looking down at specific activities or objectives, you can see a line chart like this that would have, you know, whatever date range you happen to have in the system, you can put in there. The other thing you can do is put in timeline points from before you implemented the system. So you can go back and say, I'm going to put in the data from the last 3 years so that I can have that chart to compare.
Thank you.
I kind of have a question following up on that. So like when you generate this report, like what we're looking at right now, and you send out that URL, that's just the data up to that point. This isn't like a live updated spreadsheet. So let's say you had more car seats installed. Would that line graph chart change, or is it basically static at this point?
When you generate it, it's static currently. But what you could do is go back in very quickly and just update that, the one chart in there for the line chart in there, update that, and then republish it, and it goes to the same URL. So if they click on that same URL again, they'll get the updated information. Now, again, this is still in growth, and one of the next plans is to have a nightly update batch that will run that. So you pick a web page like this and say, I want this updated nightly. You have a little checkbox next to it, and every night it'll go in and update all of the components to that web page. That's not here yet, but it'll probably be out within the next 30 to 60 days, I would say.
And as far as the web page goes, there's no way to like embed this. Like as far as it's just gonna, that's the way it's gonna look. There's no way this could be on like our community website, or it could be on the Riverstone Health website. It's basically just gonna look how it looks, correct?
Correct. At this point.
The link into the website?
Well, the link, yeah, the link is static. It's on our servers, and it's a direct link. So you can put a page on your website that actually goes to our page. So if you click on a link in your website, it takes you to a page. It's actually our page.
Right, but it won't be branded Riverstone Health. It'll look just like we see it.
Well, no, the top logo, the branding will be at the top logo up here will be your logo, and then this header will say Riverstone Health. So this is our USA Public Health, our little department. Instead of USA Public Health, it would say, your department, performance indicators.
Okay.
And your logo.
And then of course, people who've been using it, since the inception a few months ago, they might have 10 or 11 indicators already in there.
Yeah.
So is there any way to brand to a coalition with regard to some of the performance indicators, not specifically to our health department?
So when we say brand, you mean like maybe the description, or are you talking about the logo, or?
Well, up in the right-hand corner where you have the logo for public health, and I guess I'm assuming that would say Riverstone Health, but if we wanted it to reflect the coalition, and there are some performance indicators with regard to the coalition work and the chip, can it actually have a logo for the coalition? Are they kind of mix and match at various performance?
Yeah, what we would have to do is build and we have no problem doing this. You could build a separate organization for the coalition, because this is at the organization level right now. Now, it doesn't mean that it has to stay that way. We could probably also give you an option to upload a logo that you wanted on each page. The default would be your Riverstone logo, but then you could go in and say, I want to change that logo and upload. That'd be pretty easy to do as well.
Okay, thank you.
We just have a couple minutes because we have another meeting at 2:30.
Okay.
Were you planning to go over the cost?
Absolutely. The last bullet on here, just wanted you to know that it is a cloud-based system. You only need a web browser on your end and a clean link to our server through your firewall, and that's all you need. So pricing-wise, let's go here.
Does that mean any updates would be automatic?
Yep. Yeah, everything resides on our server. So when we do the updates, which by the way, we do very regularly, adding all these new features that our clients are requesting, you get the benefit of that immediately. And we do an announcement, and we never take anything away, but we're always adding lots and lots of cool new features. So pricing model.
Browser requirements?
Do what?
Are there any specific browser requirements?
Yes, we need to use either Google Chrome or Firefox. Microsoft does not fully support HTML5, which is the back end to this tool here. So it's not fast. It doesn't display some of the screens right. So we do request that you use either Firefox. Safari works good if you're an Apple shop, but primarily Firefox and Chrome.
Is it mobile friendly?
It's not specific to mobile, so there's not specific web pages. However, we use it on our iPads all the time. It's great on an iPad. A little too condensed for a phone screen. It will work. I mean, it's there, but obviously it's going to be kind of tiny print. What we are looking
Okay.
at for a future rollout is actually having mobile apps primarily for doing the quick updates. So when people get that quick update email, they can click on it, it'll open the app on their phone. They can, because it's so easy, just add in a few numbers and save it, and you're done. So pricing wise, you had mentioned you have 65 people in the public health organization. If you were to get all those folks on there, not counting any external partners at this point, the annual fee would be $5,300, and that's the only fee there is. There's no startup, no training, no anything else. Everything is included. The quick start is included. Everything is in there. It's $5,300 per year.
And what was the 6,000 that was just up there?
Well, that's for 100 users.
What happens is,
Oh, okay.
just to let you know, I mean, let's say we want to accommodate the very small health departments and as well as the large health departments. Of course, it would get extremely pricey for a large health department to do it at $100 per user per year. So there are cutoffs. After 50, the price per user goes down. So when you get into the 500s, the 600s, it goes down from there. So that's why you saw the different number in the rate.
Yeah, the aggregate, if I go to 100, if I go to 50, is $100 per user per year. If I go to 100, the second 50 are $20 per user per year. So the aggregate rate drops to 60. And then if you go over 125, it drops down. So, but that's again, like Andrea said, we scale it back. So we know that we want to have public health departments at every size, and we have them at every size, up to 700 or 800 folks on the system, and down as low as 3 or 4 folks on the system. So. What else?
I just had a clarifying question. You maybe already answered this, but just when you have like multiple people reporting in that quick update, let's say there are 5 people installing car seats. So can they all go in and add just like what they did, and then that goes to an aggregate? So the goal is, say, it's 100, and each week you have 5 people and each putting a little bit in. Does that allow for that in that quick update?
Exactly. And what you do is you'd set up, let's say you had 5 different companies that you had hired to do the installation. You'd have an activity for each of those companies. So Andrea's car seats would do 20 a week. Fred's would do 20 a week. Bill's would do 20 a week. Each one of them would be assigned to the individual user. So what it would do is they would each put in that, and then it would aggregate that at the objective level, and it would show you the total of what everybody put in.
Thank you.
What else?
I don't think anything at this point. If you wouldn't mind sending us the recording, just for a few other people that weren't able to join today. And then
Okay.
We have a few other demonstrations that we're looking at, but we're hoping to make a decision, by February. And then we will get back to you regardless of what our decision is. But we really appreciate all the information and the demonstration. And then if anyone wants to view it or ask more questions, we'll certainly set up another time with you.
Yeah, we're happy to do this as often as you need it to be done. And Andrea will send you this price quote, and as soon as we get the recording posted to YouTube, we'll send you that link so you'll have access to it.
That's awesome. Thank you so much.
Thank you, and you guys have a great rest of your week.
Thanks,
Thank
Fred.
you too. Bye.
Thanks, everybody. Bye-bye.